Cindy, can you describe your injury? Just don't mention the profession, but tell us about the injury that you had to your upper neck.
Oh, a friend of mine, don't say what profession.
Right, just she was practicing a
She was
technique.
practicing a technique on my neck while she was still in school herself. And after she did the technique, I had a somatosensory experience and I couldn't hear anything or had warmth on one half of my head. And since then, when I turn my head, I feel some, I can't fully turn sometimes when driving. Feel a little bit of some jamming up there.
How high up do you think this jamming is?
Very high.
Very high up in your
Very
neck?
high, yes.
Okay, good, good. I want to talk about what I find in your upper cervical spine. We've basically screened the rest of your body to make sure that there's no reflex influence from the lower body. And we've discussed that on other parts of our website and in other videos. I'm not going to belabor the point. What I find on your upper cervical spine is that the occiput appears to be side bent right and rotated left. So when I come under the mastoid and I try to induce side bending of your head to the left, there's considerable resistance. When I come under your left mastoid and try to induce side bending with very small amount of force of 1 digit, I can induce side bending. When I test rotation, I come in front on the front of the mastoid, and on the left I'm springing you and you rotate left. And when I come on the right, I spring you and there is some motion available. It's restricted, but it's available. There's some resistance to it. Now if I walk across with my fingers and I block C1 and C2 on the right, and I clasp your forehead, I can actually rotate your head to the right a generous amount. So the rotation is preserved. When I do the same thing, I try and side bend your head left, it's not there. I am pushing on your head above the ear, and I cannot induce side bending. It seems like you might be one of those folks in which the shape of the right occipitoatlantal or the uppermost joint where your head and your neck connect, in which it has a different shape, perhaps greater concavity in the in this direction, such that it could have a greater excursion in side bending than rotation. Basically, what I'm going to do is try to restore only the side bending in that joint. Now we know that side bending and rotation couple opposite in the occipitoatlantal joint, but it looks to me like you have a greater excursion in side bending and that it is restricted. And that might explain the injury. Maybe this person did a typical and appropriate maneuver, but because your anatomy is different, maybe it set you up for an injury. But my point is to summarize that the uppermost joint where the occiput and the first cervical vertebrae connect, I'm going to submit that because you present as having much greater restricted side bending motion, and you appear to be side bent to the right, and there is a little bit of passive rotation available, I'm going to treat it just to restore the side bending, and we'll come back and see how you feel. Thanks very much.